Health Initiative to create a safety net of behavioral health supports in our community. Today, we are joined by organization leaders providing community supports to improve services in the community that will stabilize individuals and prevent crisis. Our goal with the series of webinars is to give the audience an opportunity to learn about the great work being done in the community and how supports from behavioral health are assisting that effort. Please join me in welcoming our first presenter, William Wagner, PhD, LCSW, Executive Director of Central Savila, here to speak with us about the mission of his organization, the programs, theory of change, and how Central Savila provides culturally and linguistically appropriate peer-based support services.
Hi, thank you, Amber, and thank you all for being here. My name is Bill Wagner. I'm a clinical social worker and a medical anthropologist. And where those two professions align is that they're really focused on how people make meaning of their world. And we don't take as a given that we all have the same worldview. And so part of behavioral health, part of mental health is how do we all understand each other and how do we communicate with each other to provide support, especially when it's most badly needed. Before I get going, I would like to really thank the county and the forward vision of the behavioral health initiative of the county, because it really has brought together a number of us providers in the community and supported our work and helped us to better connect through services. So I'm really proud to be part of the BHI and the hard work that the county's doing on that level. I don't know if the slides are showing right now. I'm not in the right view, but just so I follow whether or not they're going. There is a picture of me that was pre-COVID, and I have absolutely no comment on that. It's been rough on all of us, but I would like to say that, you know, one of the things that is really critical about the work that we're doing at Central Savila is trying to stay connected during a time that has been very isolating for a lot of people. And a lot of the work that we're doing these days is very much like this meeting that we're on, that we're connected in a socially distanced and safe way as much as we can. But there are services that we can't do this way. There are services that really require us to be in person and accompanying people. And one of the things that is central to our model at Central Savila is being there, being witness, being present, being connected, and knowing that a lot of the underlying mental health needs of people come from unmet needs that cause toxic stress, that cause us to be anxious, to be depressed, to withdraw, to avoid things, that can cause trauma in and of themselves. And so if we're going to be addressing somebody's mental health needs, we really need to be focused from a client-centered perspective on everything that's affecting them. And in our language, in public health, we talk about social determinants of health. And that's everything that happens outside of your doctor's visit, whether it be with a therapist or it be with your medical doctor or some other provider, that impact your health. And we know that over 80% of our health concerns have something that can't be just addressed in a doctor's visit. And so in our world, working from a perspective of case management, skip over the first slide of me as quickly as you can. But the next slide really shows what our model is, which is to be focusing on, you know, having a client-centered approach. And for that, a lot of our work just so you know a little bit about our origin, we started in a South Valley office, and we now have 4 offices, but we always are trying to locate our offices in communities, particularly communities that are lacking in these services. So we have 2 offices in the International District, 1 office right at Coronado Park, where people get picked up to go to the Westside Emergency Housing Center, and our original office in the South Valley. And really what we're trying to do is not only address the needs broadly, but we're looking at who we're serving. And a lot of people that have been sort of left out are not, they're not English with their first language, or culturally and linguistically, they're not like me, that English was my first language. And I didn't grow up here in New Mexico. So we've really emphasized on how we can build our behavioral health workforce so that it is representative of the demographic of people that use our services. So it's really important to us. The next slide shows really our philosophy of change and theory of change that really starts with a client-centered approach, which talks very specifically about traumas that people face. So it's trauma-informed, client-centered, and really trying to focus on a strengths-based model. We always, look at where people, even if they are having serious problems in their life, where are their strengths? And we want to raise those up as much as we can instead of just looking at deficiencies. Part of that's just common sense. That's how you build a relationship with people. But it's also recognizing the human capital, the strength in every individual, and not focusing only on things that need to change, but things that are good and that if they are reinforced can help bring upon change. And what I wanted to talk about, and certainly the next group will be talking even more depth about, is the work of our peer case managers. And that is it embodies the idea of mental health coming from people that are experts. And experts doesn't mean that you just simply have titles on your wall. That's important, that you have an education and you know some of the most basic tenets, but also the lived experience of having dealt with a substance use issue, having dealt with a serious mental illness, or having dealt with a physical issue like a traumatic brain injury. There's more to it than just the medical aspect of it. There is the aspect of it, even though these are all serious diseases, there is the aspect of what does one of those or a combination of those do to you in terms of your social needs, in terms of your relationships. What are the challenges in getting help? We're trying, and the BHI is a good example of trying to build a network, a safety net, that knowing there's no gaps in it, in which if you reach out, you're going to find help. And a lot of times our system is just not intuitive. It's not one in which if you reach out, you know which door to go to, you know where to call, you know who to trust. And so building a network of peers that have lived experience, that have had some success in navigating these complex systems themselves is a huge asset, and something that needs to undergird our whole healthcare system. Not simply behavioral health, but just people that know how to navigate and understand the barriers that people experience when they're going through it. So the next slide. Who is a peer support? What is a peer support? Like I said, it's somebody who's lived in and has experienced it. I wanted to highlight 2 of our peers at Centro Savila, Carla and Tomas. They have both lived in the communities that they've served. They've both overcome challenges themselves and have real expertise in how to get needs met. And what we're doing at Centro Savila, as at many of our partner organizations within the BHI, is saying, you are the expert, help us to connect, help us to navigate, help us to do everything that we can't do in a 45-minute therapy session, because that's as important, if not more important, than what goes on in psychotherapy. I think there's one more slide. So what do peer support workers do? They connect emotionally. They have the lived experience of having been there, done that. And so, you know, they build trust. They provide psychoeducation information about how you do things. Most importantly, it's not just handing off a brochure. It's like I said, there are some things that you can't just do over the phone or over Skype. Sometimes it's getting out in the community and going to appointments with people, advocating for them, and knowing what the needs are. A lot of times, as a therapist, you might not know how difficult it is to get something like childcare or just to get your SNAP benefits set up. So knowing how to navigate these systems and actually get things done, and really the basis on how we support people is, did you hit benchmarks? Did you help them with the needs that they came in to address? And the needs that they came in to address are defined by them, not just by us, that we just say, oh, we know what you need. We ask them and we work on a you know, a treatment plan that is in sync with them, because that's what will keep them coming. And that's what will engage people on a longer term basis. And then they're just models. They're models, they're role models for us all about how to be strong, how to be resilient, and how to overcome obstacles, whether they're personal obstacles, medical obstacles, or the obstacles that are out there in our community. And they do exist, but we are working together to address them. Next slide. And so they have an impact, and we're still working on ways to document the full impact of what they do. It's important to know that there's all sorts of evidence that they not only prevent suffering, unnecessary suffering, but they save money. And we're talking about moving upstream. So instead of waiting for things to get to a crisis level, we're moving things in a direction of prevention rather than intervention at late moments in life. And so, you know, prevention is not just cost effective. It's not just a smart way to do things. It's a humane way, and it's the most effective way to do things. You don't have to wait till people get to the point of an overdose or to the point of, you know, being incapacitated to say it's time to get help and we know how to do it. So, you know, I can't speak high enough of peers. I have great admiration of the work they do, and I am just really grateful that the county is prioritizing this as one of the ways that we can address mental health. It is a way that takes into account social determinants of health and doesn't blame the victim. That's so important. I think so much of our mental health system has stigma around it and often says, well, there's judgments placed on people that are struggling with disease. And I think we as a country are rethinking that one, because there's all sorts of human suffering involved with that. There's all sorts of waste involved with that, the most important, which is human life. So thank you for having me. And I don't know if there's going to be a question and answer section later. I would be happy to answer any questions.
Thank you, Bill. Yes, the Q&A will come at the end of the 3 presentations. Thank you for taking the time. We enjoyed your presentation. At this time, we would like to introduce Evan Roth, CPSW and Associate Director, and Donato Velasco, CPSW with Albuquerque Center for Hope and Recovery, here to speak about the organization's program services, which are centered around the peer support model.
Thank you, Amber, for the introduction, and thank you everyone who's joining with us. Like Bill said, I'd really like to thank Bernalillo County for really stepping up and putting behavioral health at the priority of ways to better strengthen the community that we live in. My name's Evan. I'm a certified peer support worker and the Associate Director of the Albuquerque Center for Hope and Recovery. But first and foremost, before any of that, I am a person in long-term recovery from mental health and substance use issues. And I really like to say that, just because that's kind of who I am, where I've come from, and I don't let that really define who I am as a person, but the potential that I can become, right? And so I'd like to welcome anyone out there that may be having any type of mental health issues themselves, let you know that now is not forever, and you are the sky, and the weather always changes. So please, if you need help and support, there's plenty of it around New Mexico, and help is out there. Please reach out if you need to. I'd like to talk a little bit about what we do at the center and how peer support and the programs we offer at Albuquerque Center for Hope and Recovery have really helped me and others recover in a positive manner from our mental health issues. And so our mission is to support people who live with mental health and co-occurring mental health and substance use challenges. We do that through peer support in a safe environment. We aim to help people experience that positive life growth by focusing on hope, humor, and personal responsibility. When I first came to ACHR, that's what really stood out to me, was that focusing on hope, humor, and personal responsibility. And those are all different tools that I use in my own recovery. Go ahead, next slide, please. This one's just a little bit about the populations we serve. Honestly, if you come through the door, you're welcome. If someone knocks on our door or calls our phone number, they're usually calling for a reason, and that's really only the criteria that we have. We don't turn anyone down for age or gender or anything. We really welcome anyone who just wants to make that positive life growth for themselves. All of our staff at the center have completely different backgrounds, and so does any member that comes through our door. And so we really try and promote the fact that mental health and substance use affect anyone at any level, no matter who you are, where you are. It can affect your life. And so we try and match that to the people that come through our doors. You know what? I completely forgot to let Donato introduce himself. Sorry, bud. And so Donato is a person who came to ACHR as well, and I'll let him tell you a little bit about his story. Donato.
Hey everybody, my name is Donato Velasco. As Amber mentioned, I'm a CPSW with Albuquerque Center for Hope and Recovery. And like Evan had mentioned, the staff that we have here ACHR are all peers. We all have some sort of lived experience with this, and be it substance use, mental health issues, what have you. And, that allows us to have this dynamic team to offer any one of these individuals, in this list that may need services, and allows us to work together. And so, that being said, I first came to ACHR as a member. I was dealing with substance use and a lot of mental health issues. And one of the programs that really stuck out to me was the A2A program. And it's a recovery program that's based around physical fitness and like personal self-discovery. And being in the environment with other individuals and having a program facilitated by peers that have been through the same things, that have experienced the same feelings, thoughts, emotions, was incredibly beneficial. And it was something that I had never experienced before. And I'd gone through traditional counseling and stuff like that. And it's a totally different dynamic. And so when you find something like that clicks a little bit better and differently, you tend to grasp onto that. And so going from a member now to a CPSW working with ACHR has been incredible, because now I can also see how vital peer support can be in the behavioral health services in the community. And it just bridges that gap between, having an individual feel like he or she is actually working through something, that they're connected to something, and they don't feel alone and they don't feel outcasted in any way. And so that's my little spiel.
Yeah, you bring up a really good point there, Donato. Like, I remember when I first started my recovery journey and I decided like I wanted to live a different way of life. I didn't want to continue with the swings of anxiety and depression. I didn't know anyone who was doing the positive things in life that I wanted to do. The only people that I knew were the ones who were doing the stuff that I didn't want to do anymore. And when I found peer support, it really allowed me to have a mentor and have a role model and someone like displaying these values and these characteristics that I wanted for myself. And they really showed me that recovery was possible and that you could really become the individual that you wanted to be. And they really helped me to find out what help was available, whether it was therapy, whether it was case management. Therapy is one of those things that was just never really talked about in the circles that I was around. And it was kind of like, just not really talked about. And I thought getting therapy made me weak, but after talking to other peers, I was really able to kind of see the benefits that it had done to them. And even now, 8 years into my recovery journey, I still use a therapist, and really work on those coping skills and self-awareness strategies. Can we have the next slide, please? And so all of the programs and services that happen at ACHR, they all come from being peer run. And when I say peer run, I don't mean the staff at ACHR. I mean the members that walk through the door. Donato mentioned the A2A program. That we have that because someone came to us and said, I think having exercise would really help me in my recovery. and help me manage any reactivation of trauma. And so we went out and we found A2A, and we started A2A here in Albuquerque. And it started with one person meeting with someone in a gym and doing the curriculum piece in a parking lot, to having what we do 6 groups a week right now. We have 2 different instructors, and it's just one of those things that someone said, I think exercise is going to help me in my recovery. Okay, let's go do that. Same thing for a lot of our programs. Art was one of the things that really helped a lot of people with their anxiety, you know, and now to see Donato kind of pick that up and go with it and be able to use his art for not only him, but for other members that come through. And any of our groups, any of our programs are always because one of our members came up to us and said, we need this in our lives. Like, this is what's going to help us, whether it's that mental and emotional support and dealing with coping skills, or whether it's very actual tangible stuff, like we need help with transportation, we need help getting a better education, we need help looking for employment, housing, whatever it may be. We make sure that we have the tools available to really help in all those areas. You know, and I just look back to my recovery journey, and in the very beginning, like, I wish I had people that would help me. Like, I didn't know how to get health insurance when I first started recovery. That was mind-boggling to me. And it took someone sitting down with me and showing me like this is the website, this is the number to call, this is how we talk to the people. And it was hard because all those phone calls were so frustrating. But to have someone there with me really helped me guide through the process, because I was one of those, I would get frustrated really easy and it would show. And usually it would end up with me just hanging up the phone and you know, experiencing adverse mental health for a week or more, you know, just because of one phone call. And so to have someone help me and guide me through it in a way that can be productive and beneficial was so important. And so these are just some of the programs and services we've had, and I can tell you each one of them, every one of our groups, every one of our programs, these are all things in one way or another that have helped me in my mental health, you know, and go from just being a mess. It's so hard for me to describe. I always think of like a tangled ball of rubber bands. Like, that's kind of how I describe how my mental health was before. And you know, little by little we were able to kind of unravel that, and I'm not so wound up anymore. And it's through a lot of these programs. Donato, what are some of the other things that have helped you deal with your mental health?
So along with A2A, even, you know, having the ability to work for an organization like this and be able to work in job development, and like Evan said, the various groups that we have throughout the week, that I'm a very like mind-oriented individual. So being able to help individuals navigate employment networks and help, you know, with writing resumes and all the grammatical pieces and technical pieces that go into that, and like a cover letter, all the way down to, you know, skills revolved around the workplace, or pro-social skills, being able to feel comfortable with who you are and kind of what the situation you're in, and be aware of how you're feeling in those certain situations. Being able to work on that every day has helped me incredibly. Kind of subconsciously, you know, there's some days where, you know, I show up to work and it feels like a work, you know, I don't think of it as that way. And then, you know, there's those eye-opening moments where I do realize that I truly love what I do, and I can see how much it's impacting the individuals that we serve, but also myself, also my coworkers, and also Evan. And it's just this big, like, I don't know how else to describe it. It's just this big ball of energy that just feeds everybody that gets intertwined with it. And it's incredible. It's just, I don't know a better way to put it than that. And it's allowing us to create a stronger, more aware community.
Yeah, the peer support, it's just one of those things that works both ways. Knowing that there's someone who understands what I've gone through to be able to sit there and talk with me is paramount. ACHR was founded by 3 individuals who were seeking behavioral health services in a very hospitalized medical setting. And although it was definitely helping them, they said, you know what, we need something more, because my mental health crises don't always happen on a Tuesday at 2:00. And so they got together on a couch in someone's living room, drinking coffee, and started discussing what was important for their recovery. What are the things that are holding them back? What are the successes they've had? And 20 years later today, we still try and really hold those values high. Coffee is one of our staples. That's one of the best things to kind of get the conversation going. And we always try and keep that living room atmosphere for our members, because we know how important it is to just talk about whatever it is we need to talk about. Maybe I'm mad at my therapist. Like, who do I talk to when I'm mad at my therapist? Well, let me talk to someone else who understands what it could be like. And it has happened. I've gotten mad at my therapist and then got on mad, and we have emotions. But yeah, we stayed at that kind of living room on the couch with a cup of coffee and being able to work through that stuff with each other. As a peer-run organization, we really promote service in the community, whether it's staff members or whoever. Big part of my recovery has been a service to my community. I was a high utilizer. I utilized whether it was hospitals or the justice system or whatever it was. I took a lot from the community. And so one of the things I like to do is always make sure I'm giving back, and to make sure that we're peer run. Like, our board of directors has to be 50% of people in recovery. We have certified peer support workers, and we also train the peers that are coming in. Part of becoming a CPSW is getting 40 hours of practical experience. And so we help individuals get that. And we always try and promote from within, right? I started as a volunteer with ACHR 4 or 5 years ago. Johnny was one of the original members of the A2A program, and now he is the lead A2A coach. Donato also came in through the A2A program, and now he's working for us doing these different job development pieces. So whether it's helping support our members, our own staff, just the community as a whole, we always want to see our peers grow and develop in a manner that they want to. One of the biggest things in recovery that I've found is that I get to choose who I want to be today, and I get to set those goals to become that person. Once a year, we do a project with the state for mental health services, and we conduct phone surveys, and we get to hire peers from our community, which we've been doing right now, and that's been great. It's always great to be able to offer these other opportunities to people, you know, because I know what it's like to watch people have given up on me, and I don't ever want to be that person that gives up on another person trying to change their life. Like, we always want to make sure that opportunity for growth is there for all of us. Kind of a no peer left behind attitude. Next slide, please. And we had this one. This is our current staff here, all pre-COVID. So we have myself, we have Donato, we have Johnny Armijo, who runs the A2A, Jenna Krutzer, she's a Pathways navigator, and also along with Wesley Sinqua, all just amazing people, all people with that lived experience, you know, and you're kind of seeing these pictures of us at our best, right? But know that behind every single one of these pictures is an immense story filled with humor and tragedy and heartache and hard work and determination. I always like to think of like an Olympic athlete, right? You see them up there holding the gold, but what you don't see is the hard work and the blood and the sweat and the tears that have gone into getting there, all the mistakes and walls we've hit along the way. It wasn't an easy process getting to where we are now as peers, but we've been through a lot of it, and we can help people get through their barriers and help them, and so maybe they don't have to have as much go through a lot of the same stuffs we've had to go through, you know. So, and next slide, please. And here's a slide. I don't know, for anyone watching live, maybe you can rewatch, take a screenshot. We also have our website, achrnm.org, to get a hold of us, all our phone numbers, email addresses. We do have 2 offices. Our main office is on 913 2nd Street. It's at 2nd, just north of Lomas. And we also meet over at the Central and Unser Library for individuals. It is open. They do have computers. We have a little room that we meet community members in. Stop by, say hi, you know, whatever it is. Anything from helping with a job to, hey, I just need to talk. You know, whatever it is, we want to make sure that we're here for people in recovery. Donato, final words?
Man, I don't think I could say it any better. You know, thank you again to the county for allowing us to present and to highlight the work that, you know, ACHR and Central Cellular are doing here within our community.
Yeah, you know, and I just want to encourage anyone out there, like, there's help available. Like, please reach out. There are hands there to help you up.
Thank you, Evan and Donato, for sharing your personal experiences. At this time, please join me in welcoming Megan Aragon, the clinical manager with Department of Behavioral Health Services here at Bernalillo County, to talk about the department's supportive aftercare program.
Good afternoon, everyone. My name is Megan Aragon, as Amber mentioned, and I am the clinical manager, and I, with a team, help oversee and run the supportive aftercare community, better known as SAC. So our program is really focused on helping individuals transition back into the community and provide them with that space and support to kind of like, you know, the presentations earlier from Dr. Wagner and from the Center of Hope and Recovery, having that support to transition and learn to be a fully engaged community member again, because that is so important. And we feel strongly in the program that the individuals that we serve are some of the best people to kind of help our community grow and develop. And we need them to take stake in that and to develop an active role in that. So we really encourage that. And we want them to see that there is value in themselves, and there is value in leaning on their community and finding the strengths in their community. So we are a program, we are a 6-month transitional living program where individuals can come to us that are currently in detox and or a rehab program and are looking for something longer term to continue to develop and strengthen their recovery. And like the slide says here, what we really focus on is the strengths of the individual and learning and helping them learn how to utilize the strengths of their surrounding community. Next slide, please. All right, so we emphasize daily living skills and long-term management of recovery. You know, for some, this might come as a shock. For some, it is not a shock, but that structure is a huge part of recovery for our clients. They really, for so many of them, whether it's short-term or long-term, they were lacking that sense of structure in their life when they were, in the thick of the addiction process. So that structure really helps them to kind of maintain and organize, along with support from mental health clinicians and medical providers. All of that, it's a very collaborative approach. So the program is voluntary. It's provided at no cost to qualifying New Mexico residents seeking recovery and support services, like it says here, after they've completed a detox or rehab services. Clients are screened by a team to ensure appropriateness for the level of care and support provided, and the support we can provide to them. And for an individual to access our program and our application, there, like I said, there is a process to apply to our program. You can always contact the Department of Behavioral Health Services and we can put you in contact with that application, or you can even stop by our campus here at 5901 Zuni Southeast and ask for an application. Or if you're working with a case manager from like one of these community resources, you can have them get in contact with us and we can put them in contact with the application and we can start the process from there. Individuals who are in the SAC program, to tell you a little more about how it works, it is a phase-based program. So you would start out in the pink phase and they stay largely on campus and really focus in, since they're in the early stages of their recovery, on what their medical needs might be, what their behavioral health needs, and what their recovery needs are going to look like. They are assigned a care coordinator who works closely with them and is a mental health professional that will help them to address those. We also, again, really believe in using the community around us to strengthen this individual's, recovery process and give them the best shot at recovery. So individuals will sit down with their care coordinator, they'll go over what they need, and in the pink phase, the first phase of the program, we really dive into those needs. As you can imagine, a lot of our clients have not seen their primary care doctor or a dentist in a good while, so we will get them connected to those services. Some examples of services that we use are First Nations, both for the medical team and medical services, also dental. We often utilize First Nations. We utilize other, UNMH, of course, the UNMH Truman Clinic. We also utilize All Nations, Healthcare for the Homeless. Those are just a few of the examples of the community resources that we are regularly engaged with to help our clients meet their needs. As clients progress through each of the phases, there is a total of 5 phases, and as they progress through them, clients kind of earn and gain more individual freedoms, and with freedom comes responsibility. So halfway through our program, our clients can start engaging in work. We're really excited now that clients can return to working. Of course, during COVID, our clients were largely quarantined to our campus for safety purposes, but as things have become safer, vaccines have become available, we've made those available to our clients. We're slowly returning them back into the community again as we knew it. So we're excited about that. But we highly encourage, and that's one of the things that we ask when we're interviewing somebody, is if they have a work history or they think they're able to work. And you do have an alternative option. Clients do have that option to either go to work or go to school, or they can do both. So again, it's really about finding what it is that they want to do with their recovery, how they want to take this opportunity and kind of move forward with it. So the vast majority of our clients do elect to go to work, but we have had a few clients that have either started at CNM or UNM, and we've even had a few clients that have elected to pick up with their education and complete their GEDs when they're with us in the program. So it's very individual based, and while there are some kind of standard structured rules, we really take each person that sits in front of us and really look to meet their needs. All right, next slide, please. So a very unique component to our supportive aftercare program is the Mariposa program. And to our knowledge, it's one of the only programs like it that maybe even exists in the state, possibly even in the Southwest. So it's a unique program that allows pregnant or recently postpartum women who are struggling with addiction issues to begin treatment and have a safe and supportive living environment and remain with their baby after delivery. So a lot of our women come in while they're pregnant, they start to program, they mesh right into the community, they leave obviously to have baby, and then they and baby return to our community. So we love having moms and babies because they just offer a unique component and they offer a unique perspective to the recovery process for sure. And that process has a value as well. We are very supportive of the mother-baby bonding experience. And we really seek to offer mom a safe space to explore her substance abuse issues and maintain her recovery. This is a very special collaboration between our department, DBHS, and the Milagro program of the University of New Mexico Hospital. All right, next slide, please. So the treatment modality that we use in SAC is the community reinforcement approach, which is an evidence-based curriculum. Each week, clients receive approximately 100 hours of programming each week, which is more than just CRA. We do things like topic processes, healthy eating, budgeting, journaling, and I'll go over some of this in my later slide, particularly journaling, because that's a community collaboration that we engage in. As clients begin to progress and they are on campus less and less, and they start transitioning out to whatever, some clients choose to get apartments, some clients return to families, and some clients step down to sober living communities like the Endorphin Power Company, Hoffman Hall. We help them figure out what their next step is, and we're starting that from day one, beginning to look at what their next option might be, so that way they can have a plan to safely go somewhere, and it's not just, your 6 months are up, it's time to go, and you're back out on the streets. That's obviously the last thing we want for them. So when clients are working, we consider that part of their 100 hours of programming each week. Clients are asked to be responsible with that privilege to be able to work. And depending on what the client's needs are after they're getting ready to leave SAC, we may ask them to save up to 70% of their weekly income to begin to save for an apartment, to move back home, whatever it is they need. They will work with their care coordinator and address those needs. This picture we have here, every year for Halloween, we have a SAC pumpkin carving contest, and the clients get pretty into it. And these were our winners from this past year. And I believe, if I'm remembering correctly, it was the pumpkin in the middle that won first place this year. All right, so our next slide, please. All right, so just a little bit more about the treatment modality that we use. So CRA is a psychosocial intervention for individuals with alcohol and other drug use disorders. It has been adapted for several populations, and we find that it has been highly effective with our population. The focus is to help individuals find healthier, more adaptive ways to meet their social and emotional needs other than using substances. Our clinicians and our patients work collaboratively on identifying individual goals and conducting a functional analysis of substance use. What this means, what we explore to do, or what we aim to do through this exploration, is looking at both the positive and negative outcomes of their substance use, and both short-term positive and negative and long-term negative and positive. Because for some of our clients, not having to address their depression, not having to address the problems at home, using drugs or alcohol is a short-term positive consequence for them. And so to deny that is not, that's not how we get somebody closer to examining all aspects of their substance abuse and really identifying that although it offered short-term relief, it doesn't provide a long-term answer to the problem, nor does it really provide a solution. So our functional analysis that is offered through CRA is one of our greatest tools, and it's really neat to see clients who enter the program, in the pink and early on phases, do this functional analysis versus somebody who's halfway through or towards the end of the curriculum really talk about how their perspective changed, how they began to see things in a different way, and they really now understand how their substance use was interfering with their life. CRA is a 25-week curriculum, and some of the topics include relapse prevention, triggers, healthy relationships. Those are just some of the examples of the curriculum. So we find it works really well, and it touches kind of the major areas that we need to discuss with our clients. Now, of course, I would say probably 90% of our clients are co-occurring, meaning they have another diagnosed mental health issue like depression or anxiety. To address those needs, we strongly believe in referring to a community provider that they can continue engaging with after they leave SAC. So we've actually had some clients engage, and we refer to counseling to Centro Savila, for example. We've had a few clients in the past engage with addicts to athletes just as another option and layer to their recovery for support. Again, many of our clients choose to engage with 12-step programs and take on a sponsor. And we really encourage whatever it is that's going to build their network of support, we encourage them to do that. So again, it's all about layering those levels of support for the individual. All right, next slide, please. So since August 1st, 2014, we have served 296 unique individuals in our program, 200 males, 96 females. The number for the females does include our Mariposa moms. SAC actually goes back further than that, but in 2014 is when we changed to an online database. So that's when we were able to pull this information from. The picture of our cat right there is our beloved facility program cat, that is Simba. Simba was actually found by our clients. He was kind of an abandoned kitty back behind our building, and he followed our clients in one day, and our former director was a big animal lover, and she said, if the community votes to keep him, you all can keep him as long as you take care of him. And he's a very beloved member of our community. And you'd be surprised even the number of clients that have said having an animal in the facility, although Simba's definitely not a therapy cat in terms of being trained, he definitely provides support, and he's quite fun to watch and see him chase flies and all of those good things. But a number of clients have explained that having an animal in the facility makes them feel more at home, makes them feel comfortable, and it just feels like a more home environment. So we're very grateful Simba chose our community to come and live with us. Next slide, please. I just want to quickly share this with you because a number of a number of people, and the common perception is that heroin and meth are our biggest problems in New Mexico, and they definitely are something that we need to continue addressing. Alcohol remains the largest substance of choice for the clients that we serve. And this is a smaller sample, of 75 people, but this is reflective of the larger numbers of what we see on our campus. So alcohol still remains the #1 substance of choice. And then you can see behind that, meth and opiates are tied right behind that. So there is still a need to address the issues with alcohol that we have in New Mexico and Bernalillo County, along with other substances, of course. All right, next slide, please. So some of our community connections, aside from behavioral health and medical and physical health, are our collaboration with Parks and Recs from Bernalillo County. We started this collaboration 3-4 years ago. And so Bernalillo County Parks and Rec will come either on site. Pre-COVID, they were picking up our clients and taking them to engage in unique experiences. Some of those experiences included going to Lobo football and basketball games, going fishing. They got to go skiing up in Santa Fe. They did whitewater rafting in Taos. And in the December of 2019, we took them to Popejoy for the first time to see the orchestra. And it's just amazing to see adults engage in something that some of them have never had the opportunity at any point of their life to almost light up in a childlike way, to go whitewater rafting or to go skiing or, you know, to go to the ballet or the orchestra for the first time. When we took clients to Lobo games, it was one of the coolest things to see because they were so excited to go to the pit for the first time. And some of them like, I've heard about the pit my whole life. In fact, I used to sleep on a street right across the pit or, you know, something, but I've never been in the pit. So we're really grateful for this collaboration and this partnership. Of course, during COVID, we've had to kind of transition and pivot. So what we did during COVID is Parks and Rec would still come and they would bring a mobile rec unit and they would set up activities like cornhole, horseshoes, PlayStation games, and we could still safely distance and be outside and able to do that. But as things are getting better, we look forward to returning to activities like hikes and basketball games and football games and things like that. They also engage in things like quilting, photography, pottery, things that are offered at our local county community centers. And what's cool is we've had a number of clients that even after they complete the SAC program, they continue to engage in those programs and they go to those community centers, and that's what this is all about. We have a journaling group that we have found very, very effective, as it's led by a professional writer and a professional journalist, Lynn. Lynn really guides our clients through this kind of meditative process of journaling, and clients have found it very complementary to the curriculum we offer. And she now offers the second Sunday of every month, she offers a group to clients that are no longer in SAC so they can return and continue her journaling group. So we're really excited about that. We also have a local dietitian and nutritionist, Shelly, who helps our clients. I guess one thing that people often overlook in recovery is the need to address diet and nutrition needs. A lot of our clients, depending on their story, have either never learned how to cook, or, you know, it's been something they haven't done in years, or some clients are really sound with it, but they need to start switching, you know, how they eat as a result of, you know, other health complications, high blood pressure, cholesterol, diabetes, things of that nature. Or even what we've experienced is a lot of clients early in recovery, that those real significant cravings for sweets and sugars, and they want to learn how to kind of manage those in healthier ways. So, you know, I'm by no means an expert on that. So we reached out and developed this collaboration, and Shelly offers a group to our clients every other month. And it's a great connection. In fact, a client was showing me today a smoothie Shelly taught them how to make, and he's excited about it. And his goal is to lose 20 pounds and make all the gains. So I might actually be referring him to A2A here very soon, now that we're able to get our clients out in the community. Next slide, please. And that's a quick overview of SAC for you.
Thank you, Megan. We'd like to provide this time for viewers to ask any questions via the chat or on YouTube live stream.
No comments yet through there.
Okay, let me go ahead and start a question. What impacts on behavioral health have you seen as a result of COVID, And what are your thoughts on the long terms that the pandemic will have on the landscape of behavioral health service delivery? Go ahead, Bill.
Well, I think for certain we all have a recognition now that healthcare is something that impacts all of us. And as the COVID virus doesn't really pay any attention to wealth or borders, we need to have a structure that can address the kind of things that come up when healthcare isn't accessible. And so the BHI is one example. Access to health insurance, access to providers in your community, telehealth, all of these things are things that cut down barriers for people accessing healthcare. I think it's important that we have a national discussion, a local discussion of what are those barriers and how can we get rid of them. Because as I said before, the social suffering that we all experience, and not just the people who get sick, but all of us, we've all had to change our lives dramatically because of the pandemic. You know, how are we all connected? And anyone who's in public health, I think, has part of that mentality and knows these things, and it's becoming more obvious to the whole community. I think specifically, and one of the things that we're talking about today is changing the narrative around mental health and changing the narrative around substance use. We've been, you know, having the same approach towards addictions for, you know, at least since the 80s. It's been a long time, and the war on drugs had a huge impact on the way substance use disorder was addressed. And most of it was heavy on shame and blame, and not heavy on really understanding the function, as we talked about, as you talked about in the functional assessment, that it serves in our community, and the increased disparities and differences in our communities that a public health approach that really was based on the war on drugs had in our community, in our society. So what I mean specifically about that is that specific communities were targeted around, you know, who was going to be arrested, who was going to get punishment instead of treatment. I hope that we're getting to a place as a country that we don't focus first on punishment. We focus on that this is a disease. This is something that is deserving of healthcare, and we focus on that first, and have more of a harm reduction approach towards it, in which, you know, it doesn't have to be straight up stop it, abstinence, just say no, but this is a part of a person's life that has a function. How can we make it healthier? How can we make it safer? How can we decrease this person's risk and the people around them's risk of suffering or dying from this? So I think that we are in a change, and I do believe that that the kind of programs that the county is supporting reflects not just the work of providers, but the goals and the wants and the needs of our community to address this in a more humane way.
Thank you, Bill. Does anybody else want to add to Bill's comments about the long-term effects of COVID on the mental health, behavioral health system?
Yeah, sure. I'll take a crack at it. So through the pandemic, it's definitely been roller coaster ride for everyone, and we've definitely seen people disproportionately affected for whatever reasons. You know, there's been some not so great stuff and some great stuff to come out of it. I think one of the biggest things we've seen is a lot of individuals early on. We were all getting on these Zoom meetings and we were doing Zoom groups, and I was doing all kinds of Zoom groups for my own recovery and for ACHR. And quickly I found out, and I wasn't the only one, that Zoom burnout was a real thing, right? And so we saw this at the beginning. We had a lot of people in all our virtual groups, and then slowly it kind of started dwindling down, and then it kind of come back up a little bit. And I think one of the biggest things I've seen is people kind of isolating, and I'm no exception. You know, there was times throughout the pandemic that I would isolate as much as I could. You know, but thanks to having behavioral health services, I was able to identify that and say, hey, I'm isolating too much. Let me reach out for help in whatever way that is. You know, and like Bill said, that importance of that human connection and that one-on-one is so important. You know, there's like we made sure our doors stayed open too, not only for that, but what doing everything telehealth created was a situation where a lot of people that we work with may not have access to technology, may not have Wi-Fi at the house. Maybe they don't have a computer. Maybe they don't know how to use their phone to get on their telehealth appointments. You know, that smartphone's a steep learning curve. And I'm sure I'm still vastly underusing my smartphone. I'm sure there's many more things I could use it for that I don't, right? But helping individuals to access these. We have people who come in just so that they can make their telehealth appointments. We have individuals that come in so they can do the things like get a hold of their social security or make those MVD appointments, or all these services that we took for granted that we could just go into the office, that all of a sudden we can't do that anymore. And so really helping people with that. As far as like long-term effects on mental health that COVID has, you know, I'm not an expert on the matter, but what I do know is that we've all kind of gone through this together, and it's been very traumatic in a lot of different ways for a lot of people, whether it's dealing with unemployment or unstable housing conditions as a result of it. I think all of us have been through these traumas, and so as a result, like, we need to be able to address these, and how do we move forward from these so they don't affect our decisions in the future. I've talked to a lot of people. There's people that are afraid to go back to work because they're uncertain. Like, if I go back to work and, you know, then, you know, we get shut down again, what's going to happen then? Or, you know, I don't know. It's just a whole variety of things. And so really working with individuals to make sure any fears that we may have developed from the pandemic don't continue to manifest in our lives, and working through it. And okay, how do we move on in a positive way from these? I think it's been great in that we've been able to realize the power of our technology in the ways that especially with A2A, where at one point we were able to only did it in one gym. It happened in one gym, and the group happened there, and if you couldn't get there, you couldn't get there. And so there's another barrier. And through the technology, we found that the virtual groups work really well. And so now creating a hybrid model of it, that, you know, we can meet in a gym, but there's also accessibility for people who can't. or maybe, you know, maybe they are in a program such as SAC and they want to participate, but, you know, we can't make that happen. Well, join us online, join us virtually. And so by creating these hybrid models, we're able to bring the peer support and what we do to a larger audience and more people. And you don't have to be in Albuquerque to experience what Albuquerque Center for Hope and Recovery has. That's about all I got.
Nice response, Evan. Thank you very much. Megan, do you have any additional comments on that question?
Well, I think just to kind of to touch on the general topic and COVID, and what I really hope we've amplified, or I think what COVID amplified, is the importance of behavioral health and taking your behavioral health seriously and getting your needs met. But that's easier said than done, right? We still have such a shortage for mental health professionals in our state and nationally. And when I say professionals, I mean, yes, our psychologists, our psychiatrists, but I also mean our counselors, our social workers, and our peers as well, because that falls under the umbrella of a behavioral health professional, a mental health professional. And I think, I hope we, as a result of COVID, we see the tide change in terms of continuing to break stigma, continuing to see the importance of funding come to, you know, agencies that are trying to address these problems. And to kind of touch on what, you know, Dr. Wagner said about the war on drugs, I feel like as a professional in America, we've tried to simplify addiction and make it seem like a simple choice. Addiction is so much more complicated than a choice. If it was a matter of a simple choice, I think we would have found the cure, if you will, a long time ago. But obviously, this is one of the most complex diseases that exists. That's why there is no one single approach to helping somebody reach recovery. And I think we have to start valuing all approaches to recovery, whether it's medication-assisted treatment, whether it's therapy, whether it's, you know, having a peer support specialist, whatever that means, we have to start supporting it. And I think too, we have to start supporting individuals in recovery. We so often want to isolate them and kind of tell people, well, figure it out on your own. And addiction can be isolating enough, and it's time to start welcoming individuals back into the community and stop with this stigma of you're in recovery or you're trying to enter recovery, and seeing it as a, you know, they're a separate population, they're a separate being. No, there are neighbors, there are community members, there are friends and our loved ones. And when we start looking at it differently, I think we'll start seeing recovery differently. We'll start valuing our mental health professionals differently, and we'll start placing value on things that we have not valued in our country for far too long. So I just hope that COVID continues to shine a spotlight on the importance of taking care of each and every one of our behavioral health needs.
Thank you, Megan. I want to go ahead and bring this webinar to a closure. So thank you for all those who participated, to our panelists who presented today. Please join us on Monday, May 17th at 10 a.m. for our housing supports on the BHI webinar for the May mental health. Thank you again. You guys have a good day.